And I would like to invite another speaker from Malaysia, Professor Rohaizat. Hello, Rohaizat, are you there?
Hello, yeah, I'm sharing my slides now.
Okay, okay.
Okay.
Are you okay?
So
He's the head of the Community Medicine Department from the National University of Malaysia, Kuala Lumpur. And he also work. Yes, please carry on. Yes.
Oh, yeah, please continue, Professor. Yeah.
He also worked for as a frontline healthcare professional, as a doctor, as well as he worked as a community health and epidemiologist for this COVID-19. So that we will be very delightful to listen to your presentation, and we can learn a lot from you.
Yeah, thank you very much, Professor, and good evening, everybody. So today I would like to share some experience from Malaysia in our community engagement experiences in battling COVID-19 in Malaysia. Basically, what we have, all the actions that we have taken is more or less the same with the other countries, especially with our neighboring countries like Philippines, Singapore, and Indonesia. So let me share a bit on an overview of the Malaysian COVID situation. As for now, we have quite a good control on the COVID-19 in our country, where the new cases is coming down, and we are managed to keep it as low as at one time last week we have only 2 cases reported per day, but in total we have 8,529 cases overall, and with 121 deaths, which is about 1.42%. And now the recovery rate is very high, which is 93.79%. Okay, and there's no more patients in ICU, which is a good news for us at the moment, and things is getting better and better, hopefully. Yeah. So, but to start with, we have the first case in Malaysia on the 25th of January 2020, where we have visitors from China. So from there, cases keep coming up until we have our own cluster from our religious, one of the religious gathering in middle of March, 40 days after the first cases. Then on the 15th of March, we have that cluster, and the cases is going up very fast. So the government has decided that we need to have a partial lockdown. We do not use the word lockdown so much in our country because as our colleague from Philippines says that the word lockdown means that the government has to spend a lot of resources and everything. So we use the word MCOs, which is only a movement control order. And very interesting, the first time in Malaysia, we apply these MCOs by using the law for an act under the infectious disease control. Before this, we just used that law to investigate all the infectious diseases. But at this time, we closed the country by using that law. So we have several phases of movement control order. The first one in March until 3rd of May. And after that, when things getting better, we changed the movement control order into a conditional, which means that we open up a few economic and industries, but with a very tight SOPs. But in between the MCOs, there is another term used, extended MCO, and this is a very tight, enhanced movement control order, and this is almost 100% similar to what we call as a lockdown. But as we can see that after the several phases of the movement control orders, we managed to reduce the curve, reduce the cases and flatten the curve. And as we can see that the number of daily reported cases is coming down, and the number of the recovery is coming up. Until a few days ago, on the 7th of June, on the 10th of June, then the government declares that the phase for the conditional MCOs is over, and now we are in the stage of recovery. One thing I would like to highlight is in Malaysia, we are so concerned about elderly because looking at the death, 66.7% is above 60 years old. So elderly is a very vulnerable group that we are really concerned. And when we analyze the data, about 17% of the cases is coming from this age group, and which is a very high rate in the mortality among the elderly. So what are the how Malaysian community respond to this COVID? Basically, community acceptance to the new normal introduced by the government is very good. We can see that the public awareness towards healthcare, towards infection control and personal hygiene is very drastically increased. We are not so familiar with using face masks or doing hand washing because of the weather maybe, but now using a face mask is a must, and people are carrying sanitizers here and there, and also we are implementing the coughing and sneezing manner to become a regular practice. And surprisingly, if we go to any elevators now, they have the sanitizers provided there, or they use the cotton bud to press the elevator's button at the moment. So now, even now in the how people start to accommodate is basically when we go to grocers, we can see that social distancing is being practiced with a limiting number of customers present, looking by adapting into the space of the grocery. Okay. And the utmost Malaysians awareness and attitude which changed drastically is on the how to get the information, because as WHO said, we are not only dealing with the pandemic, but we are also we are also battling with infodemic, which there are so many news which is not verified throughout the social media, everything. So because of that, the government has taken an action with our community by giving the first verified news to the community. So every day, most of us are waiting for 5 p.m. breaking news by our Director General of Health, giving us all the verified information and the status. And I think every one of us is looking forward for that 5 p.m. Breaking news. And of course, if we go to the everywhere now, we have to take the temperature and register ourselves with the one app provided we call My Sejahtera or My Wellness, where we have to scan the barcode and then they will do the risk assessment before we can enter even to the supermarket. Okay, and okay, for the social distancing and movement control orders, of course, in the initial stage, the adaptations is very difficult because it comes with enforcement, a bit of enforcement. But after a while, people are start adapting. Of course, there is a very strict restriction of movement, very difficult to adapt with one person only can go and buy food and groceries, which we have to show our ID card to the police at the roadblock. And worst case is that during these MCOs and movement restrictions orders, majority of Malaysians are Muslim, and we are celebrating Ramadan and also the Eid Mubarak, which this year is totally 100% different, celebrating at home and only socializing using the internet and social media. Okay, but recently, once the government loosened the MCO and CMCO by opening more businesses, we are opening a part of the universities for research, and next week we are opening up schools for the exam years students, where we can see there's a lot of things being done in terms of social distancing. The tight SOPs, you can see all the lines on the floor, and all the seats is being crossed where you have to distance yourself from others. And also in the MRT, you can see that the distancing is being practiced strictly. Okay? So now communities are getting familiar with social distancing, with space interventions, and furthermore, coming back to work is not actually 100%. We are still implementing 70% availability in the office, depending on how big is your office, but only 70%. The other 30% is still allowed to stay at home and do the work from home process. And one thing I would like to share is basically from the NGOs. From the very beginning, they come out with the word of hashtag Kita Jaga Kita, which means that we take care of each other. And these NGOs and volunteers participate alongside with the community, okay, to battle this COVID-19. So they start all this movement. One is to help the hospitals and the frontliners by giving, they sue the PPEs and provide to the hospitals. And also they provide the food to the people who is staying basically in the rural area. Okay, so this concept of sharing the kindness movement was very popular from the very beginning, and they use the hashtag Kita Jaga Kita. And through social media, they are working very good throughout this pandemic. Well, as I mentioned earlier in the first presentation, we are also implementing this no 3Cs, crowded places, confined places, and close conversations at the moment. And of course, I think the best practice now is to take care of the hygiene. We give more education to our community to have the good practice on you have to wear mask when you are dealing with more people. Then, of course, with all this practice, I think we can maintain what we have achieved so far. Thank you very much for your attention.
Thank you very much, Rohaizat. It's a very comprehensive, and we can learn a lot of the lessons from how the Malaysia community and also the academics and authority and NGO tackled the COVID-19.